Dorothea Orem's self-care deficit theory, nursing interventions. Dorothea Orem nursing theory background. The selected nursing theorist is Dorothea Orem, who came up with the theory of self-care deficit. Dorothea Orem was born in Baltimore, the United States of America, where she undertook and earned her nursing diploma at Providence Hospital Nursing School in Washington, D.C. She pursued a Bachelor of Science degree in nursing at the Catholic University of America in 1939. Dorothea further advanced her studies and earned her Master of Science degree in nursing education in 1945. Professionally, Orem worked as a staff nurse, private duty nurse, nurse educator, administrator, and nurse consultant, where she acquired relevant first-hand experience in nursing practice. Moreover, due to her strong desire to advance her knowledge of nursing practice, she received honorary doctoral degree awards from 3 educational institutions, namely, Incarnate Word College, Georgetown University, and Illinois Wesleyan University. Development and incorporation of Orem's theory to enhance nursing knowledge and care delivery took place from 1959 to 1985. Orem developed the self-care deficit theory intending to improve the quality of hospital nursing care. Dorothea Orem theory of self-care deficit analysis. The theory encompasses 3 major interrelated components essential to achieving improved nursing practice. The 3 components enable nurses to assess and identify diverse patient needs and provide observable measures that restore the patient's self-care abilities. The components include nursing agency, self-care, and self-care deficit. Self-care describes the body's ability to conduct normal body functions at full potential to achieve a good status of development and wellness for a good quality of life. Quiros, Vidna, and Filio state that the body purposefully regulates its functional mechanism to achieve and maintain normal processes. The self-care concept provides nurses with an understanding of the normal body conditions essential for individual self-care ability. Self-care deficit indicates the limited abilities of an individual to provide care for oneself either on a partial level or a complete level. According to O'Shaughnessy, the limited inner body potential limits an individual's ability to provide self-care. Therefore, the self-care deficit is an important concept for detecting deficits in an individual's functional ability and enhances customized nursing services. Nursing care aims to enhance a patient's quality of life. Nurses, therefore, assess the patient's self-care ability, identify the deficit, and customize the nursing care to fit the needs of the individual. Nurses agency refers to the body of trained nurses with the practical and professional knowledge to provide therapeutic self-care needs to patients through the adoption of best practices and customized patient self-care services. O'Shaughnessy explains that nurses provide nursing care to enhance the achievement of individual maximum self-care potential. Hence, nurses intervene to provide supportive measures to improve individual self-care. The 3 components interrelate in nursing practice to promote the quality of care of a patient. Nurses working as components of a nursing agency engage in assessing patients' self-care potential and determining suitable care specific for each patient while continually observing the patient's recovery process to ascertain the impact of self-care. Self-care requires nursing actions that provide an understanding of individual patient self-care needs and procedures to meet the patient's care demands. Assessment of inner abilities enhances understanding of patients' diverse needs for different nursing care. Relevance of the theory. Dorothea Orem's experience in nursing. The extensive experience of Dorothea Orem in nursing is relevant to the theory because it boosts its validity, reliability, and application in nursing. The self-care deficit theory equips nurses with the relevant knowledge required in their daily care delivery. According to Hashemi et al., the self-care deficit concept is essential to nurses in examining the diverse needs of different patients depending on their innate abilities. The self-care deficit theory provides nurses with structured steps, which identify patient needs and customizations of self-care interventions. Orem's theory of self-care deficit is relevant to nursing as it equips nurses with a practical model for designing and developing a progressive care plan tailored to meet the unique needs of patients. The relevance of self-care theory in healthcare. The 3 basic components of Orem's theory enhance its relevance to healthcare practice. The self-care concept is essential in determining a patient's innate ability to provide self-care for a particular health requirement. O'Shaughnessy argues that self-care deficit theory acts as a structured component for the assessment of patient needs and proper determination of the specific required care intervention. Self-care deficit concept is important in healthcare determination of a patient's limited innate ability to achieve the deliberate condition of maintaining a healthy functional status. Knowledge of the deficit informs nurses to design customized patient self-care interventions and enable patients to achieve quality services of self-care. A nursing agency then provides trained healthcare providers who assess patient needs, determine customized self-care for particular patients, and deliver continued refined self-care through monitoring of patient progress to attain independent self-care. The theory, therefore, promotes self-care delivery in nursing practice through proper identification of the patient's self-care abilities and the deficit of the individual innate ability to provide independent self-care. Self-care deficit application in nursing care. Orem's theory is applicable in research and nursing practice as it acts as a model of research to the diverse healthcare problems and needs. According to Gatlin and Insel, Orem's theory acts as a model that provides a conceptual framework for research and enhances the understanding of the nursing needs of patients. The test of the theory in healthcare research enhances understanding of the three major concepts that form the fundamental units of self-care delivery. In nursing practice, self-care deficit theory offers a structured approach for assessing innate abilities and determination of a tailored care intervention with continued monitoring of progress to attain independent self-care. Conclusively, self-care deficit theory acts as a conceptual structure for the advancement of healthcare knowledge through research and the delivery of quality self-care to needy patients in nursing practice. Summary. Strengths of the self-care theory. Orem's theory is applicable in the entire nursing practice. The conceptual framework is relevant for practice both in research and nursing practice at all levels. The theory provides only three major concepts of self-care, self-care deficit, and nursing agency, which are testable in nursing research for improved delivery of quality self-care. The concepts are easy to understand and provide three simple intervention systems, which include supportive education and whole and partial compensations, describing the relevant action requirements for attaining patient self-care recovery. Moreover, the theory describes the specific point of need for nursing care and the processes of self-care delivery as patient needs assessment, tailored self-care intervention, and continued monitoring of progress. Limitations of the self-care theory. The theory fails to describe the multifaceted external effects of the nurse-patient relationship. The environmental influence on the nurse-patient relationship is fundamental in the delivery of self-care. Conducive environmental conditions enhance optimum attainment and recovery of individuals as self-care is dependent on the patient's needs. Gatlin and Insel describe the external environment as the conditioning factor necessary for improved quality of life among patients. Therefore, achieving enhanced patient quality of life requires consideration of external factors. Additionally, the theory relies excessively on the ideal healthcare model and depicts a patient's condition to be explicitly dependent on nursing care.